Good.
It's from last week.
Right.
On the 29th. It came out the day after we recorded our last episode. As Regina ICU swells with COVID-19 cases, younger people are taking up more beds. And essentially, it's an article where they're talking about the increase in like the ICU capacity they were at 115% capacity as of this as of this article. They had 17 out of their normal 20 beds, and then they had an additional 10 surge beds that were all filled up. So you had like 27 out of 30 beds with COVID-19 patients. Yep. And they were talking about how this is the product of these COVID patients. While usually patients stay in ICU for 1-2 days, maybe 4 days max, COVID patients are in ICU sometimes for weeks.
Yeah.
So that's not good.
Yeah, no, it's not. It's reminding me of how before all of this, like before COVID, if you were on the interwebs, as they were, listening to people talk about vaccinations and the anti-vax movement, sort of where that came from.
Right.
One of the points that gets brought up is it is a testament to how good vaccines are that the anti-vax movement can exist.
Right.
Because we have forgotten about smallpox. We have forgotten about the horrors of polio, right? Like these are things that we don't have to live with. I think we're seeing a microcosm of that with COVID. Yeah. We're a year into this thing. We're getting numb. People are just not paying attention. And so, yes, I know so-and-so's uncle passed away or grandfather or kid or who, like we've heard those stories. And I think people are suffering from sort of an empathy overload that's too many people reach this point where they don't have the empathy reserves left anymore.
Yeah.
And go, I miss my friend. I'm going to go visit, or I need to do this, or and I think we're both broken records on this at this point. And because I see it daily. There are these gray areas where people are just skirting the edge. And there's the blatant folks, right? There are definitely 100% the people who don't, who believe this is a hoax or believe that if you drink enough olive oil, it'll go away or whatever. So there is that facet. But I think it's not just the anti-vaxxers or the anti-maskers or the COVID hoaxers that are driving this. I think, and I've talked about my ex a lot when it comes to this, and because I'm so frustrated, but it's someone who believes in COVID, believes it's real, believes masks are important, believes social distancing is important, believes all of the lockdown measures are important, everyone should follow them, but still is visiting a friend this afternoon. Because, that's fine. It doesn't really count. That's not really breaking. We're going to go for a walk, and it's outside, so it doesn't count. Right. But I'm looking at the weather, and 3 hours in, they're not outside walking anymore, right? Like it got windy, it got snowy, so we went inside, but it's fine. Like we were intending to walk. And, I went over to my mom's for supper, but it's okay because she's in my bubble. And then I went over to my girlfriend's because she's in my bubble. And I went over to my brother's because he's in my bubble. And eventually that's not a bubble anymore. And and other people are doing it. I want to make this all about my personal stuff. But you hear this all the time and I've talked about this too. Like we can't live perfect lives, but we're getting really bad at determining where that line is, where the gray stops. And I think that's part of what is driving this.
I mean, to kind of deter it from being all about the one person as an example, like my father, he lists off the places he goes, and okay, he's going to this place and he's meeting this number of people, and those people, like his bubble maybe is small and he's only going to 3 places, but they're public places and he's going there and meeting people that he doesn't live with. And my daughter is similar, and she's got her friends, and of course they're teenagers. They absolutely want to see their friends.
Yep.
And they go to school all day together. They wear masks, but then they go out for lunch and then they take off their masks and they're eating. I mean, she says, "Oh, well, we're eating outside. It's fine." Well, I don't know. Is it
And I even find myself, I'm pretty stringent about this. And I this last 2 weeks, I did my grocery shopping online. So I haven't had physical contact with anyone other than my kids and my co-parent, which is enough. But, I think back over the last couple months, was I as diligent in the grocery store as I was 10 months ago? Probably not. I still tried to be, but when I got, I think to myself, I get in the grocery store and I'm thinking about my routine. So I go in, do the hand sanitizer, but I did the hand sanitizer on my hands, but I make a specific point of thoroughly wiping down the cart. Well, I don't have to because the store themselves does it, but the store themselves thinking, well, maybe
customers are going to do it. So
customers are going to do it, right? So are people getting, and they're probably not, I'm probably fine. Am I maybe 5 feet from the person in front of me in the grocery store instead of the 8 that I used to be? Because they said 6, but I made it, gave it an extra 2 just to be on the safe side. Now they said 6, but it's 5, probably fine. We're all doing stuff like that to some degree or another, I think. I try very hard not to, but I think if I'm going to be honest and hold myself to the same level of accountability, I kind of hope others are holding themselves to. I'm sure there are areas where I've gotten more slack, and you see it in the numbers.
Yeah, that's right.
And now we're racing against the vaccine, and hopefully we can get everyone vaccinated before things get even worse. But you can't say before things get too bad because they're already too bad. They are already at the breaking point. So
yeah, that's right. And that sort of brings us to our other article, that building on the same thing.
Yeah,
it is very bad. Regina doctors say the situation in COVID-19 ICU is dire. Last week we're at 115% capacity. And then suddenly the numbers have gone up. So where we used to have 27 last week, now we have 31 patients in the ICU that are COVID related. So, we're already we're over our, just with COVID patients, we're over our capacity.
And again, this impacts not just COVID patients, right? So this means if someone has a heart attack, if someone gets a concussion, if someone has a diabetic reaction, all of these things where you would normally need an ICU bed, those beds are full. So it has a domino effect, and we need to get back to that same level of diligence that we had a year ago. That light is at the end of the tunnel. We can see it. I'm checking the Saskatchewan website literally daily to watching the threshold for booking vaccinations drop. It's at 50 as of today. I'm hoping, I'm 44, so I'm hoping within a week or so I can book an appointment to go get vaccinated. And so wait this thing out, but we need to be better while waiting till we hit that point. So
I
don't know what there's much more to say on that front other than our hospitals are bursting, and the other point, and again this feeds back into the budget that we'll talk about more later, is this is also what happens when you have 20 years of austerity. And I'm saying 20, I'm not just holding the
right.
Sask party accountable. This is a decade of one and then a decade of the other, of austerity and cuts that we were doing okay leading into COVID, and we didn't have wiggle room. We didn't have a cushion if something went wrong. Yeah. And this is what happens. Like, this is what happens when you don't keep a spare tire in your trunk and you get a flat.
Yep,
like, this is what happens when you don't have extra capacity within your healthcare system, and then you end up needing extra capacity. So,
yeah, that's right. And in a sense, I mean, okay, this ties into other articles we're going to discuss on this, but in a sense, like, we see the light at the end of the tunnel, but we need to have like an actual like pulling back of freedoms, I guess, quote unquote. Like, we need to actually do a more firm lockdown with firmer rules. And that also means that we need better support from our governments for people who aren't going to be able to go to work or who have to stay home to homeschool their children or, various things. And that's just, it's not a thing that our government is willing to do at this point, which is extremely frustrating.